Hi, my name is Theo Hodge, and I'm an infectious disease specialist at the Washington Health Institute in Washington, D.C.
And I'm Brittany Yerkes, a physician assistant at ViiV Healthcare in Salisbury, Maryland.
And we're here
for Ask Me Anything About CABENUVA.
CABENUVA is for virologically suppressed adults and adolescents with HIV-1 who meet certain requirements. See full indication on screen. It is contraindicated in patients with a previous hypersensitivity reaction to cabotegravir or rilpivirine and in patients receiving the medications listed here. Please watch the entire video for additional important safety information. Please click the link to view the prescribing information for CABENUVA.
Okay, let's get into it. How did you start providing CABENUVA in your practice?
3 steps. So step 1, we actually had to sit down and formulate a reimbursement team. Step 2 was actually developing a workflow. And step 3 was actually, okay, let's talk about the time that it takes from the time the patient walks in to the time the patient walks out. So what about yours?
Even though our practices are so geographically different, you're in urban DC, I'm in rural Maryland, we have lots of similarities. We similarly identified kind of the core team members who were going to be responsible for organizing CABENUVA. We also coordinated with our reimbursement specialist, and we looked to see what different payer requirements were for insurances.
Sounds not too dissimilar from my experience.
Right, yeah.
Okay, Brittany, I think it's time to move on to question number 2.
Let's do it.
All right. How does your team work together to implement CABENUVA in your practice?
Great question. So when I first identify a patient as being appropriate for CABENUVA, the first person I talk to is our nurse case manager. We kind of have a warm handoff, and she really is the champion in our clinic for coordinating our CABENUVA program. She schedules all the patient appointments. She pulls weekly reports to make sure medications are in office and that patients are within their windows. And then she also is the person that is responsible for most of the injecting in the office. And then we also have a clinical pharmacist who's a great asset to our office, and he's available for any questions that come up about CABENUVA in general. We also have nurses on staff that also went through the training. We all kind of did that initially to make sure everyone was on board, and that if we ever had any issues with our nurse case manager being out of the office, that we'd have backup so that patients could stay on schedule. How about you?
In my practice, our nurse case manager handles staff refresher trainings and tracks patient injection windows, while our medical assistants, they're the ones who actually administer CABENUVA. I am very proactive about making sure that my patients are aware of every option they have in terms of HIV treatment. So when patients come in, I always ask them about, hey, how is this going for you? And my patients are very vocal. Now, if I identify a patient who actually is an appropriate candidate, then I send a message to my reimbursement team. And then I let the patient know, hey, we will contact you to see how and when this medication will be in the office.
Okay, let's move on to our final question.
Final question.
So how does your team ensure CABENUVA continues to be supported in your clinic?
We have routine training. It's done on a quarterly basis, and we have to make sure that my current medical assistants, as well as those who are newly hired, are trained. And that makes such a huge difference in my practice because it's all about the injector. That continued support has made a meaningful difference in sustaining CABENUVA in our clinic. And today, we have about 150 patients on CABENUVA. What about you?
That sounds like a great system. I think the key to our team is just being really adaptable, having strong communication. Thankfully, how our office is situated, we have a nurse case manager and our clinical pharmacist. We have frequent communication, and if a problem arises or if there's an issue that we need to discuss, we can have those conversations easily. And so that has led us to be able to have almost 65 patients on CABENUVA currently.
Brittany, it has been an absolute pleasure doing this with you.
And we hope that you watch other videos in the series.
Warnings and precautions. Hypersensitivity reactions. Serious or severe hypersensitivity reactions, including Stevens-Johnson syndrome, toxic epidermal necrolysis, and drug reaction with eosinophilia and systemic symptoms, or DRESS, have been reported with CABENUVA or its components. Some skin reactions were accompanied by symptoms such as fever. Other skin reactions were associated with organ dysfunctions. Oral lead-in may be administered prior to administration of CABENUVA to help identify patients who may be at risk for a hypersensitivity reaction. If a hypersensitivity reaction is suspected, CABENUVA should be discontinued immediately and the patient should be monitored. Post-injection reactions. In clinical trials, serious post-injection reactions, such as those shown here, were reported in less than 1% of subjects within minutes after the injection of rilpivirine. These events may have been a result of accidental IV administration and began to resolve within a few minutes after the injection. It is important to carefully follow the instructions for use and observe patients for approximately 10 minutes after the injection. If a post-injection reaction occurs, monitor and treat as clinically indicated. Hepatotoxicity. Hepatic adverse events have been reported in patients receiving cabotegravir or rilpivirine with or without pre-existing hepatic disease or identifiable risk factors. Patients with underlying liver disease prior to treatment may be at increased risk with CABENUVA. Hepatic monitoring is recommended and discontinue if hepatotoxicity is suspected. Depressive disorders. Depressive disorders have been reported with CABENUVA or the individual components. Promptly evaluate patients with depressive symptoms. Risk of adverse reactions or loss of virologic response due to drug interactions. Adverse reactions or loss of virologic response due to drug interactions with concomitant use of CABENUVA may occur. Use with caution in combination with drugs with a known risk of torsade de Pointes. Long-acting properties and potential associated risks with CABENUVA. Residual cabotegravir and rilpivirine concentrations may remain in the systemic circulation for up to 12 months or longer. Non-adherence to injections could lead to loss of virologic response and development of resistance. It is important to initiate a fully suppressive regimen no later than 1 month after the final injection doses of CABENUVA when dosed once monthly, and no later than 2 months after the final injections of CABENUVA when dosed every 2 months. If virologic failure is suspected, switch the patient to an alternative regimen as soon as possible. Adverse reactions. The most common adverse drug reactions were injection site reactions, pyrexia, fatigue, headache, and those listed here. Drug interactions. For important drug interaction information, refer to the full prescribing information for CABENUVA, Vocabria for oral cabotegravir, and Adurant for oral rilpivirine. It is not recommended to co-administer CABENUVA with other antiretrovirals. Drugs that are strong inducers of UGT1A1 or UGT1A9 are expected to decrease the plasma concentrations of cabotegravir. Drugs that induce or inhibit CYP3A may affect the plasma concentrations of rilpivirine. Use in specific populations. Assess the potential risks of using CABENUVA during conception, pregnancy, and while breastfeeding. Please click the link to view the full prescribing information for CABENUVA.